Well, I think the interesting thing is it's very clear now that the European Union has cancer right at the top of the agenda. But with this big opportunity comes responsibility for everybody in European cancer care. We've got to work together and not compete with each other. We've got to put forward pragmatic solutions that will help beat cancer ultimately. And that sort of falls into a few items. How do we best prevent cancer? How do we improve the quality of cancer care? And how do we take care of people who've had cancer and beaten it and are survivors? Those three things are going to be extremely important in the next few years.
I'm the chair of the EFPIA Oncology Platform. The purpose of the platform is pretty simple. What we want to do is to improve patient outcomes in cancer care. We do this together with multiple stakeholders, and one of our projects is that we work with stakeholders towards a European cancer plan. The research-based industry, I think, is mainly researching and developing medicine. For patients, what counts is that they have access to innovation. And here I see a role for the European Cancer Plan that we can improve access, which also improves health outcomes for cancer patients across Europe. This is only a small part in a plan, and that's why we work with other stakeholders, because cancer plan means also prevention, it means screening, diagnosis and survivorship, and treatment is just one element. So that means we need to collaborate with other stakeholders to make it happen.
I think there's an awful lot to be done to support cancer survivors to return to work. I'd like to see a cancer plan that will harmonise the many disparities that currently exist within Europe. I'd like to see cancer treated as a disability throughout the EU so that people can be properly protected. I think Scandinavian countries do a great job in knitting together social policy and healthcare policy so that people are properly supported during and after their cancer diagnosis to manage work. In the UK and Ireland, France and Belgium and the Netherlands, there are legislation in place to support cancer survivors, and that's really important. Those countries are leading the way, but in many other countries throughout Europe, support is far patchier and a lot more needs to be done.
I think there is a very good idea to try to get a cancer plan in Europe, especially if you can focus on outcome, because we see large differences in outcome when it comes to mortality rates, loss of good working years, loss of good times of life across Europe. And there is also large differences in the amount of money that you're able to allocate to cancer care, and also the large differences in the access to new and some of them very innovative and effective cancer drugs.